Wind, it's the link of the breeze 93.9. Good morning, Sabrina.
Good morning.
I had a message here on the Facebook. Morning, Chris. We just want to say that we love you guys' show. It's coming from Joe Gaddison on Facebook Messenger. And we were looking to make the trip this past July, but we weren't able to due to the COVID. So we'd like to say stay strong and positive. Joe and Bertha Gaddison from Texas. They're also asking to give a shout out to the wife's family, Lester Uggan, Marie Uggan, Edward Uggan, and C. Jeffrey Uggan.
There you go.
There you go. Yeah. So shoot us a message, man. Hit us in the DM when you slide in. Don't slide in creepy. Just slide in. Okay. 8:25. Let's go to the CNMI. Let's slide into the CNMI's DM. Kevin, you don't mind if we slide into your DM, right?
Hi, Kevin. How are you?
Off the day. Buenas. Good morning.
Good morning.
Good
Good
morning.
morning, Bree. Good morning, Chris.
On the Zoom, KUAM News Zoom room, we have Kevin Bautista, who's the spokesman for the Office of the Governor and the NMI, where it kind of seems like they're doing way better than us. I hate to say it, and they used to bring it up in the press conferences back during the first lockdown. And man, our governor would get triggered when someone would say like, "Oh, in the CNMI they're doing this." Or sort of like, bro, it was like instant set off. She would be like, "Oh, well done." And I don't know what the history is, but I mean, we were always like, "Man, maybe you should be asking CNMI for some pointers," because damn. And I mean, that being said, though, we'll just start, Kev, with you guys had a couple positives with DOD. Can we just kind of go over that real
Yeah.
quick, and then we'll get into everything else?
Yeah, of course. No problem. Well, thank you again, Bree and Chris, for the invitation. Bree mentioned it at the top of the show. Yesterday, we announced our latest 57th case, which was a sailor deployed to Tinian from Guam as part of the team of the Naval Mobile Construction Battalion, or the Seabees, supporting a survey for our Tinian Harbor port construction project. We had Joint Region Marianas and Navy officials who have coordinated with our task force, our governor's task force officials, to safely transport the confirmed individual and a lot of the other known contacts from Tinian to Saipan. In total, it's about a group of 14 individuals. The identified sailor who confirmed COVID positive has been placed in isolation and is now at Canoa Resort here on Saipan, transferred safely from Tinian, as well as 2 additional sailors who are identified as close contacts, and the remainder of the team are now in quarantine and are in close monitoring by our doctors and nurses here on Saipan.
Have the other sailors, though, have they exhibited any signs or symptoms of COVID? Or is it too
So
early?
far, good question. So far, nothing to report on that end. The latest update that we got yesterday on our conference call with both Joint Region Marianas and our Commonwealth Healthcare Corporation. So far, it's just one individual who is exhibiting or is showing the symptoms who tested positive for COVID but is asymptomatic. So it's just one COVID positive case and within the batch itself.
What I thought was interesting was you guys were told, though, I thought, the CNMI government, that they had tested all of these sailors prior to arrival in Tinian, and they had all tested negative. So,
Yeah.
What happened was,
So it's really interesting because when test results came back, we were just as we were asking a lot of questions to DOD to see if there was anyone who broke protocol, because so far from what we've reported on Tinian both Tinian and Rota, 2 of our minor outlying islands here in the CNMI, are relatively COVID free. We've had 2 cases on Tinian in the past, but so far every time there's a case on Tinian or Rota, we would isolate that case and bring them over to Saipan for additional isolation and quarantine. But so far, Tinian remains relatively COVID-free. So we were very surprised to see that the military bubble that the DoD has informed us that they've created from Okinawa to Guam and Guam transporting over here really indicated to us that we felt that it couldn't have been from Tinian. So again, we're still having the communications, and we're really doing the contact tracing with our task force, with our CHEC, with the naval public health officials to really retrace the steps to see if there was anyone who had a breach in protocol, and really making sure that we can continue to keep Tinian and Rhoda safe.
Kevin, how's the dialogue between you guys and DOD? Because it sounds like it's pretty open, which is not what we see here.
Yeah, it's to be honest with you, it's been really open. Rear Admiral Benoni and Governor Torres have consistent dialogue throughout the pandemic. We've had some really solid support from the Department of Defense throughout the course of the pandemic. They've sent over some medical officials and some nurses and doctors who have really stepped up and helped out our CHEC because, as you know, coming from the CNMI and Guam, we have this collective idea that we know that our public health infrastructure is limited in our capacity. As an island healthcare system, we don't have a lot of resources to go around. If we can't get treated here on, we can't get treated off in the mainland just because of the travel restrictions. So given the support we've gotten from DOD, from HHS, from the federal family of partners, FEMA, of course, we've been pretty rock solid in terms of our response because we've been trying to make sure that we continue to have that dialogue and open communication as much as possible. And I think for us, both with our federal family partners, with the community here in the CNMI, I think we've been doing an excellent job in terms of making sure that we can continue to keep COVID relatively contained here in the CNMI. And so far, as Bree mentioned at the top of the show, we have 57 confirmed cases only. It's a blessing. I think it speaks to both the community's cooperation here in the CNMI, which we greatly applaud and commend. The governor has said that consistently in our press conferences here on island, with the media partners across the region and some mainland outlets as well. But at the same time, too, I think the most important word that we're using for our pandemic response since January was proactive. The governor has been very proactive since January 29, making a request to FAA to cancel flights from China, and talking to the White House and making sure that we have this dialogue where while China and our Asia Pacific market is our bread and butter for our tourism industry, just like Guam, one of the biggest things we're trying to do is making sure that we protect what we have here on islands, which are the people that call the Marianas home. And I think the most important thing for us is just knowing that we can continue to have this dialogue with our federal partners to keep COVID away from the islands, because we know that even one case here on island is one too many. And I think that the governor, our chief executive officer, Esther Muña, our task force chairman, Warren Villagomez, and all of our first responders and medical workers have been working very diligently and very hard since January to keep this contained, and hopefully we're doing a good job in doing that.
So what kind of orders is the CNMI under currently right now on Guam? We're on a PCOR 1 lockdown, stay home order, so only essential businesses are allowed to operate. Essential businesses like banks, grocery stores, clinics. You can also go buy a car by appointment only.
And you can exercise at the beach
and the parks, right?
Because you guys did have something went into effect. I want to say either last week Monday, not necessarily like what we have, but you guys had your own sort of order or guideline that you implemented, right?
So what is it now? What?
Yeah, that's correct. The governor announced on Friday, August 21st, that our COVID-19 directives have been amended for temporary implementation of restrictions on in-person interactions, social gatherings, and business hours to protect the health and safety of the people of the CNMI. So not as extreme as it is on Guam. Our restrictions are from Monday, August 24th through Sunday, September 6th. So this Sunday is the last day of these new restrictions, or these recent restrictions.
What are they?
So we've capped down our social gatherings from 25 to 10 in a single room or single space. We've limited our attendance at church services from 75 to 50%. Our business hours now are from 4 a.m. to 9 p.m. and we've limited occupancy in our businesses to 50% of the business's occupancy permitted by our Department of Public Works Building Code. Our restaurants have gone down to 50% as well. We've been very diligent in our enforcement to make sure that when restaurants and bars are conducting businesses at 50%, that we initiate the proper protective measures for contact tracing, which means that establishments must document the customer's name, phone number, and a log, which must be accessible to our health officials, so that in an event that a case would happen in a restaurant or a bar or in a business establishment, we would have the patron's name and number, and we'd call and conduct the contact tracing. And so far, our businesses engaged in gaming, including the casino and our video poker establishments and our e-gaming facilities, are closed except if authorized to operate under an authorized reopening plan by the COVID-19 task force and CHEC. In a similar way that Guam has with your public beaches, all of our public parks, public pathways, and public beaches are open only for outdoor recreation for the purposes of exercise and wellness, both physical and mental. And shoreline subsistence fishing, such as taladza, rod and reel, commercial fishing activities, continue to permit, provided only that it's within the 4 a.m. to 9 p.m. Guideline that the governor has implemented. We have a curfew here in the CNMI at 10 p.m. all the way up until 4 a.m. And again, this is only for just 2 weeks. Our social gatherings at. Go ahead.
Were these restrictions in place, during the longer period of the lockdown, maybe after January? So are these restrictions that the people in CNMI were already used to having to adhere to from maybe like a prior iteration of the lockdown?
Yes. So what we have in CNMI, it's a little bit similar to your P-Core system, but what we have is called a community vulnerability rating level system. We do it by color coding. So at the beginning of the pandemic, we've had it at level red, where most of our stay-at-home orders, actually, technically, the CNMI has actually never had a formal stay-at-home order. What the governor had implemented was just a stay-at-home guidance to inform folks in the CNMI and all residents and all businesses to stay at home as much as possible. Teleworking options are most recommended. And we wanted to engage the community's engagement with that policy. And so far, the community has been very receptive and open to those directives when we implemented them back in March, especially when you guys, Guam, announced your first 2 cases back at mid-March, I believe.
Right. Mm-hmm.
So when we got our first case on March 28th, we really went down to the nitty-gritty and forced ourselves to really hunker down, enforce a stay-at-home order, the stay-at-home guidance, and really make sure that people and human movement were limited in order to protect the safety and well-being of the CNMI community, both in Saipan, Tinian, and Rota.
I remember when you guys had your first case, it was like no flights from Guam can come in here from this date to that date. And I know people have clamored about that here on Guam about, well, we don't want any flights, shut down the airport, and we can't because of the FAA. How were you guys able to stop flights from coming into Saipan? Did you have to go through the FAA, or did you just call United and said, we don't want you guys coming here, or what?
Yeah, it was interesting, actually. So what we did was, well, first off, just for context, a lot of our commercial flights, beyond just United Airlines, which is our only U.S. carrier, are our airlines catered to our tourism market, and a lot of them pulled out naturally without any force of hand from us requesting the FAA, with the exception of just the China flights. But our Japan flights, our Skymark Airlines, they pulled out organically just because of Japan's restrictions. Then our Korean flights slowly rolled back and canceled their flights. So all we were left was with our lifeline, which was just United Airlines, our only primary U.S. carrier from Guam. What we did was Governor Torres and our Commonwealth Ports Authority contacted FAA and I had an honest conversation with United Airlines in the middle of April to stop flights for the month of April, and then resume them at the beginning of May. So we've had this So we had this conversation with United Airlines and FAA towards the beginning of April, and then we canceled flights for the remainder of April, and then resumed it back in May, just to see how far widespread community spread is within the CNMI. And we were able to do that properly, because we were able to see both through our contact tracing efforts, through guidance from our public health officials and our doctors and nurses, and anyone and everyone within our COVID-19 task force, to see how far widespread the community transmission was, because we saw that a lot of the COVID threat was happening, unfortunately to say, happening a lot from Guam, port of entry from Guam, via Hawaii, via the mainland. So, and to this day, again, unfortunately, just given our connection, I personally have family in Zigo. A lot of people here in the CMI have family in Guam and in Hawaii, but unfortunately, a lot of our COVID cases here in the CNMI have been travel related and have gone through from the mainland to Hawaii and then through Guam, and then we would catch them at the border here, because we test at the airport here immediately upon arrival, and then we also do a 5th-day testing during quarantine.
So what? You test at the airport?
Yeah.
Everybody that comes in gets tested at the airport. Is this like a rapid test, the South Korean test?
Yeah. So it's those 60,000 South Korean test kits that we received, that we procured from Sojant out of South Korea back in April.
And now those have the EUA now, right, from the FDA?
They do. Yeah, the emergency use authorization was granted, I think, in mid-May. I remember when we got those test kits. I know we made waves within the region about getting those 60,000 test kits. I think Governor Torres took a lot of flack for that, but I think, as objectively as I can be, that was one of the most important decisions he's made as a governor, as a governor for this COVID response, because the most important thing for us was that we wanted to have surveillance both at the airport and within our community-based testing, and having the test kits not just from South Korea but also the Abbott test kits that we're getting from CDC and from the mainland helped out, and so far we've been doing as best as we can.
I mean, it paid off. You're right.
I think we've
You guys did take a lot of flack, and Kev, there was so much talk about these test kits on Guam, and it was like we didn't want them, right? But what ended up happening, you put them on ice. That that EUA came through, and now you're sitting way prettier than we are.
We have
but it's still, again, it's a partnership. The governor has been very clear about this from the very beginning of the pandemic response. He personally wants to thank Governor Lulian Guerrero at the very beginning, because DPHSS collected our first batch of specimens when we were first starting out with the response. Before that, we were sending specimens all the way to Atlanta at the CDC for COVID testing, and for back then it was Linda DeNorsi and DPHSS and Governor Liu, and that governor-to-governor contact. They were able to collect our first couple of specimens, and I think the governor's been very grateful for Governor Liu at the beginning of the pandemic, and they continue to have a close relationship moving forward as best they can.
How were funerals handled in the CNMI?
Good question. Our funerals at the very beginning of our pandemic response, around March, we were very enforcing with social distancing. We still are, especially with the church services now down to back then it was initially at 25% of occupancy for the churches. Now it's at 50%, and folks have been really good at social distancing. I don't know, just like Guam, we're a very Catholic community here, but I think people have taken upon themselves and the personal responsibility while they're going to church and praying, they're watching themselves closely as well and watching their distance. For funerals, particularly, funerals continue. I think just living in an island community, we can't avoid funerals. It's a fact of life. But I think we've been really good at making sure that we maintain the integrity and the respect given to funerals while maintaining proper social distancing, but not restricting them altogether right now, because so far we're not seeing as much community spread within those events. Mostly we're seeing it within our clusters that we're identifying quickly at the beginning of the pandemic, and then isolating them accordingly first before releasing them back to the community.
Kev, I wanted to follow up on something you mentioned earlier regarding military personnel support that you guys had received. Can you go into that a little bit more? These are military nurses and doctors. When were they deployed, and was there an ask that was made by the governor there that, we need help? And is it
yes?
Is it temporary, or it's permanent, or what? And is it through FEMA?
It was a temporary deployment. Yeah, it was a temporary deployment between April and May. The governor, through the Defense Civil Authority, it's called the DISCA, the Defense Civil Authority Agreement with DOD. It's the same type of civil authority joint partnership that we've had when Super Typhoon U2 really devastated us back in 2018, where Joint Region Marianas, U.S. Indo-PACOM, and individuals from the Guam National Guard were even here to help us with our typhoon response. So in a similar fashion, through this authority and partnership with DOD, the governor was able to request DOD for additional medical support to help both our doctors and nurses. They were helping us with our testing. They were helping us with doing contact tracing, and they were helping our CHEC just on the logistical side, because we know that COVID-19 has been a logistical nightmare for everyone, both economically on the public health side, from a governmental perspective, and everything else in between. So yeah, they've been really helpful in that regard.
How long were they there for? Are they still there?
I believe they're not here anymore. They were here for about a month, I'd say. They helped us get open our medical care and treatment site, which is a kind of like an annex to our Commonwealth Healthcare Corporation hospital, as well as our alternate care site. So these two external facilities were created and planned out by our governor in coordination with FEMA and our task force to accommodate for any spikes in COVID-19 cases should that come up. One of the most important things for us was making sure that we had enough beds, we had enough ventilators, we had enough equipment on the island of Saipan to accommodate the needs for the three islands, and just in the event that a spike in cases were to happen.
Is this the tents, the FEMA tents, what is it? Field
medical stations?
Yeah. Are those still up? Are they still up?
They're still up. They've been up. Our medical care and treatment site tents outside of the hospital. And next week, the governor is going to be handing off the alternate care site at Kanoa Resort over to our hospital, which has currently 40 ICU beds, 75 ventilators, and a mid-level care site. And we're handing that off next week to the hospital doctors and nurses to continue the COVID response. Because, again, I think just for context, why we were trying to be as proactive as we can be as a Commonwealth was FEMA projected in that same projection that Guam got. FEMA projected that we would hit 8,500 cases by June if we didn't implement any protective measures within our community from the onset. And what we did was we took that seriously. We had the dialogue with FEMA. DOD was in those initial planning phases as well, with those same batch of doctors and nurses that came on board that we were just talking about earlier. And we're now in a position where we're not at 8,500. we're at 57. And I think that we're very fortunate not to see a spike in COVID cases, but at the same time, too, also making sure that we continue the 3 Ws and the social distancing that we've been imploring people to do from the get-go.
Kev, how instrumental do you believe community mass testing was for the current COVID situation in the CNMI?
Oh, it was huge, for sure. And that's a great question. Community testing, I think we were the first territory in the Pacific to do community testing the way that we did. So far, right now, we've tested about a quarter, more than a quarter of our population, about 25%, more than 25% of our population so far. And what that meant for us was that we were able to really see how widespread the transmission was. And we were able to identify clusters really quickly, and then isolate those individuals and take them away from the overall community, put them in our quarantine sites, take care of them, give them the medical attention they need, and then move forward with additional contact tracing for any auxiliary contacts and other close contacts. So I think for sure, community testing has been very beneficial for the CNMI. Yeah, I mean, you just got to give props to the governor for really going out and taking the flak at the beginning for getting 60,000 test kits from South Korea without an FDA approval. It was a very proactive decision, and it turned out wonderfully for us. And I think that we're very blessed to have that proactive leadership, and as well as our Commonwealth Healthcare Corporation really leading the way in terms of our public health response.
Go ahead, Ray.
No, go ahead.
I just wanted to ask, has there been any requests from our island here on Guam to the CNMI for help with, nurses or anything? Because as we're, experiencing a shortage.
In terms of personnel, I don't think we've made, we've had that dialogue when it comes to transferring nurses, but I do know that because we understand the gravity of the situation down in Guam, I know for a fact that we've sent down some supplies, or we've redirected supplies that we've ordered as a Commonwealth through FEMA, and then we talked to FEMA and consulted with them to direct those particular supplies to Guam first, and then we'll just wait in line since we've developed our sort of version of the National Strategic Stockpile. So we call it our Commonwealth Strategic Stockpile now. Right. So we've developed that type of stockpile to ensure that we have the PPE, medical equipment, and medical supplies on hand. Right. Just last week, we announced that FEMA awarded us $10.9 million for the reimbursement costs for that. And then we have about $40 million. We have $40 million in the pipeline coming under review by FEMA for our other medical needs that we've had to incur during the COVID response.
So what were some of those
for us? I was like,
what were some of the supplies that you directed FEMA to give to Guam?
I believe we consulted with FEMA to redirect some medical equipment and some medical supplies. I don't know too much of the details, but in some of those consultations, we redirected pretty much just medical equipment and medical supplies through FEMA over to Guam, and we've already because we feel that Guam needs it more than we do right now, and understandably so. Right.
So have you guys, just tell me the truth, Kevin, have you guys been like looking at what's happening over here on Guam, saying, "Holy Mac, get it together"?
Holy Macaniti! Easy there, Kev. Easy, bro. Easy, bro.
Oh man.
Feels like you guys are like, man, I feel bad for those guys over there.
No, I don't want to. I don't want to make it. I don't want to dramatize it too much. But
No, please do, Kev.
But no, for
us. But yeah, really, you guys were, huh?
Yeah. I mean, at the end of the day, we have to, right? I think that for sure, our governor, our task force chairman, our CEO have looked at our entire region as a whole. Where are most of our cases here in the CNMI coming from? and we're seeing it happen. We're catching it at the border. We're conducting the travel history. They have to fill out a declaration form on our governor's website, and we find out that they originate from the mainland, through Hawaii, through Guam, that classic United route, and then coming over here, and as well as some of our medical referral patients or some family and friends who live on Guam, who are over here, who come over here, and we see that too. And we're being very careful and very cognizant of the fact that we see spikes in cases across the mainland. We see spikes in cases in Hawaii. Hawaii themselves got into a lockdown around the same time you guys did.
Right.
And then you guys busted out P Corp 1. We had to also be as proactive as we can be as well, and implement the temporary restrictions that the governor implemented about a week and a half ago, and so far we're doing the best we can to really measure out how far widespread it is.
So the answer is yes. You look at Guam and you guys are like, man, whoa. Kev, let me ask you this. So what's the current protocol for people coming from Guam going into the CNMI? I'm talking about airline travel.
For sure. So for non-resident travel, any non-residents coming in from off island, they immediately go into isolation and quarantine. But then what's great about our quarantine measures is that we make it was important for us to quarantine returning residents of the CNMI and quarantine them for free at our hotels and designated facilities. But for non-residents, those individuals have to pay about $400 during their stay. And turns out that's been a very good deterrence for any non-resident traveler that has wanted to come here to CNMI for travel or for business. But so far it's been working. We have a lot of individuals who conduct business on Saipan who are based in Guam. Those individuals have to apply for an essential worker status and quarantine at our sites, and that's been both a deterrent so that we're able to advocate for more teleworking services where they can work from Guam. We have the consultations between our Guam partners and the CNMI so that we can continue to just keep folks out there where they need to be, out there away from the borders, and making sure that we can continue to look out for the folks inside the borders here in CNMI.
Out there, huh? Out there.
So that's what we are, huh? We're out there?
No, it's not like that. I mean, at the end of the day, it's one Marianas, bro.
Hey, that's it. Reunification. No, Kev, I was just wondering, because you're talking about your strategic stockpile. Are there considerable amounts of a piggy, ice keki, and blueberry bread in the CNMI strategic stockpile?
Man, I wish, man. Our business, I really wish we had that on stockpile. You know, businesses have been tough. I mean,
Yeah.
I was listening to Governor Gutierrez earlier in the show this morning, and just like what he said about the tourism industry and our small businesses, we've been hit hard. You know, fortunately for us, I think, and I can't say this enough. The governor can't say this enough as well. He is really commending our community for really adhering to the directives and being patient. We haven't seen any protests in the way that we're seeing it on Guam or anywhere else in the country. Governor Gutierrez was alluding to it a little bit. But at the same time, too, we know the realities of the economic impact here in the CNMI. If I can pull up the numbers here really quickly for you guys, we got impacted really hard pretty much since February, since we closed down the China flight, which is our second largest market. Mm-hmm. And our economic impact so far for our fiscal year 2020 budget was reduced by 48.3%. And then we're projecting a loss of about $100 million in government revenues within this current fiscal year. And our Department of Finance has preliminarily estimated the overall economic loss to be about $600 million to $700 million due to the loss of the tourism industry and the impact on domestic spending and small businesses. And this is only a preliminary estimate. So we're truly living in unprecedented times. But at the end of the day, we're trying to continue to work together as a community, support local, support small businesses, continue to work together, and really make use of all the federal assistance that we're getting through the CARES Act. We're really watching iteration of the CARES Act, whether it be the HEROES Act or the Republican package that's going to happen. Right now for us in the CNMI, we're just trying to focus on what we can get, and any type of assistance, both through the pandemic unemployment assistance, through our economic disaster loans, through PPP, and everything else in between. I think that's been very helpful for us as a community, and we can help mitigate the economic losses with that federal assistance.
Kev, could you touch a little bit on, because I follow you guys and also follow Delegate Khalili on Instagram. How would you characterize the dialogue, the cooperation, the communication between the governor and the CNMI and the delegate representing the CNMI in Washington, D.C.?
It's been at the end of the day, the dialogue is meant toward a collective goal, which is making sure that we can get every type of federal assistance available for the CNMI. And this requires us working diligently with our congressional office, regardless of politics, regardless of any bickering that is it's been well documented in the past for us. I think I can just, speaking on behalf of the governor knows how important this is to him, knows how important it is for us to remain proactive and to go after every type of federal assistance available through the CARES Act, through congressional appropriations, through federal grants, through OIA, Department of Interior, and making sure, and HHS and FEMA, and making sure that we can work and give the data over to our congressional delegate so that we can push it through in Washington. And just like it is on Guam, we only have congressional delegates. They're non-voting members of Congress. They have weight on the floor, or they have weight in committee. So having that dialogue within the committees, getting the pork barrel within federal legislation, and making sure that we can get that money home to the CNMI, to the territories, and making sure that all the territories get their fair share of the COVID money that's going around the federal government. To us, that's important. And I think, going back to your initial question, Chris, about the relationship between the governor and the delegate, for us, regardless of what's happening, what has happened in the past, we need to put that aside and continue to work together for the people of the CNMI. And to us, that's the most important thing.
That's pretty inspiring. That I mean, we track the history with the governor and Delegate Khalili, and it has been contentious. But I think it's inspiring that in this pandemic, those differences have, according to you, for the most part, been put aside in the spirit of cooperation and working together. And that's definitely something.
And
someone,
the people.
right, and the people. And someone put in the comments, there's a lot we can learn, and I think that's one thing we could definitely learn from our neighbors to the north.
So thank you so much, Kevin. Hopefully we can check in with you again maybe next week.
Yeah.
See how things are going over there.
Oh, for sure, definitely. And I actually just spoke to the governor yesterday. We'll definitely try to get him on the show.
Right.
Most likely hopefully by next week.
Okay.
Most likely next week.
Let's do it. Yeah.
Well, thanks a lot again, and stay safe.
600 Harmon Loop Road, Dedito, Guam 96929. You could put, KU care of Chris or Sabrina.
Blueberry bread.
Blueberry bread.
That's the one that I really like.
Oh, for sure.
The problem is that none of the rest of us that work here are ever going to see any of that.
I mean, it is what it is. As a gesture of goodwill between, as island neighbors, we'll send you some Denancy after you send the blueberry bread. Yeah. Got it.
Oh, no, definitely.
Hey, put some of those test kits in there, too.
Take care.
Yeah. Thanks, Kev.
Yeah. We'll
Take
just
care.
Mossy, guys.
Okay,
All right.
I'll go Moss.
Take
Okay,
care.
Josh. 904, Kev Bautista.
Great
Well,
job, man. Great job.
that was
You
fun.
guys are-
Yeah. And with Tomas Manglugno, we had him over here for the summer.
Yeah.
He went back to school, but we really did have a lot of in-depth CNMI coverage with Tomas. And, of course, we've continued that with our partners in KSPN. But, we were talking, it's like we kind of want to feel like they're just right over there. And we don't, it's like a tale of two, it is a tale of two islands.
Yeah, it really
I
is
mean-
big glaring differences.
I got friends in the CNMI and I follow them on Instagram and I'm like, where the hell are these guys at? Is this what? I want to go to CNMI.
Yeah.
But,
Good job to see
Yeah.
Hopefully everything,
He's a
knock on
really
wood, right?
good PR person.
Oh,
Yeah,
yeah, Kevin?
Very,
Yes.
very good.
Yeah, that's good. 905. We're going to take a really quick break. And as we told you, kind of dedicating this hour, obviously we'll do it again throughout the month, to suicide awareness. It is
Suicide Awareness Prevention Awareness Month.
right. And so we're going to talk with Cassiana from the University of Guam. And then we'll also bring on in a little bit Dr. Christiana Whitman, who is a doctor and also a licensed professional counselor who heads up the Guam Behavioral Health and Wellness Center's Guam Focus on Life project. Again, very alarming numbers coming out from the Office of the Medical Examiner about suicides and an increase. And it's just very troubling news. Former Governor Gutierrez, I think, very eloquently spoke on this. I think that's, something we're not hearing about from Adelup. And frankly, I'm just disappointed that the conversation that they're putting out is hating on this budget and hating on the senators, and they got all these fancy graphics to demonstrate their criticisms. And I feel like we're going to use that much energy on that, then we definitely have to dedicate more time and energy on addressing the very real mental health crisis and the mental health issues that are facing not just people who are traditionally in those vulnerable categories, but it's spilling over to